One of the biggest mindset shifts I try to help parents make is understand that chronic itching is usually just not one simple thing. In many cases, there are multiple layers contributing to why the body stays stuck in this reactive cycle. And the skin plays a huge role in this. The skin is one of the body's most important protective barriers. It's constantly interacting with the outside world while also reflecting what may be happening internally through inflammation, immune stress, digestion, nutrition, and environmental exposure. So when skin starts struggling, the body is often trying to communicate that something deeper may need support. One of the most common contributors to chronic itching is environmental allergies, things like pollen, dust, mold, and other environmental triggers that sensitive dogs may react to seasonally or maybe even year-round. We also have pest-related triggers like fleas and ticks, where the immune system reacts to the bite itself and creates inflammation and irritation. Prevention plays a huge role there, but honestly, that's an entire workshop on its own. Then we have adverse food reactions. And interestingly, dogs with environmental allergies are also much more likely to have food sensitivities or other inflammatory contributors happening at the same time. And this is where things can begin to get really confusing for pet parents because many dogs aren't necessarily reacting to the food as a whole. They may be reacting to specific proteins, ingredients, additives, preservatives, inflammatory components within the diet itself. In many food-related reactions, the immune system essentially starts treating something in the food like a threat. When that happens, the body releases histamines and other inflammatory chemicals that can result in itching, licking, redness, inflammation, ear issues, and digestive upset that you see. One important thing to keep in mind is that food sensitivities often happen over time through repeated exposure. That's why some dogs suddenly seem reactive to foods they've eaten for years without obvious issues before. One commonly overlooked contributor is inflammatory fat balance. Many processed foods contain heavily processed oils and omega-6 heavy fats that may contribute to inflammatory signaling over time in sensitive dogs, especially when the body isn't getting enough biologically useful omega-3 support to help balance that inflammatory load. And then here's one of the most overlooked contributors that I see: immune dysregulation. Dogs experience immune stressors all the time, from bug bites, environmental exposures, illnesses, vaccines, infections, inflammation. Normally, the immune system gets activated, handles the issue, and then it calms back down. But in some dogs, the system doesn't fully shut back off. And this is where mast cells become really important. I explain mast cells almost like little alarm bells throughout the skin and immune system. When they get triggered, they release histamines and other inflammatory chemicals designed to protect the body. But sometimes the alarm system gets stuck in the on position. So even after the original trigger is gone, the body can stay trapped in the itch cycle. Simply put, the immune system got pushed, mast cells overreacted, the histamine cycle continued, and the itching never fully resolves. If you're starting to realize that there may be more contributing to your dog's itching than you originally thought, I created a chronic itching root cause guide that walks through some of the most common triggers, inflammatory contributors, ingredient categories, and patterns I look for when evaluating chronic itching and skin issues. And I hope everyone tunes in for my next video, why flea and tick protection is really an inside job.